Good evening, everyone. Welcome, welcome. My name is Denise Lewis. I am a pulmonary hypertension nurse at George Washington University in Washington, D.C. And tonight, we are going to talk about exploring cultural perspectives in pulmonary hypertension. So one thing I would like to do before we really get into it is define what culture is, because I feel like a lot of times culture gets kind of misconstrued and mixed up with ethnicity, race, things like that. So we have a definitive definition of culture. So culture is defined as the customary beliefs, social forms, and material traits of a racial, religious, or social group, the characteristic features of everyday existence, such as diversions or a way of life, shared by people in a place or time, the set of shared attitudes, values, goals, and practices that characterizes an institution or organization. So with that being said, we have our wonderful panel here who I will turn it over to so they can introduce themselves to you, and then we'll get into the questions and answers. Who wants to go first? Lenice.
Hi, my name is Lenice Whitley. I'm a PH patient. I live in New York. I was diagnosed in 2012.
Hi, my name is Kira. I live here in Pueblo, Colorado. I was diagnosed with pulmonary arterial hypertension, idiopathic, in 2014. And I do a lot of work with Team Phenomenal Hope.
Hi, everyone. I'm Sofia Arevalo. I'm from Mexico. I have pulmonary arterial hypertension and lupus since 2013. I've been working with Team Phenomenal Hope since the beginning. We started Team Phenomenal Hope Mexico and also the Pulmonary Hypertension Association in Mexico. I'm happy to be here with you.
Great. Thanks for being here with us. All right, so let's get started. The first question I want to ask the panel, and I'd like to hear from everybody, if you don't mind, is what culture or cultural beliefs do you identify with? Who'd like to go first?
I consider myself an African American.
Okay.
I consider myself Latin.
I consider myself a queer, lesbian, Irish space nerd.
Excellent. All right. And then I think this is a good question for everybody just to kind of get roundabout. I know you guys talked about when you were diagnosed. How long did it take you to be diagnosed?
It took me 2 years to get a diagnosis. I had problems. I continually went to a doctor. I was continually hospitalized, but I was not diagnosed until I moved out of New Jersey and moved into New York. And so that I started having problems in 2010, and I was diagnosed in 2012.
Okay. Do you feel like, the delay in the diagnosis before had anything to do with the physicians you were seeing or the center you were going to, or just maybe they didn't understand and weren't aware of pH?
It's a lot of things. I think that doctors weren't exactly looking for it. I don't believe they were aware of pH, but I also believe that I was not properly tested. And I think that the fact that, At the time, I was in my late 50s. I was extremely overweight. I had lost my husband suddenly. And I think that a lot of it was they were basing it on that. Maybe you're stressed out because you lost your husband, you're really overweight, you're getting older, these things happen. That was what I came up with.
Yes, sounds about right. What about you, Kira?
I agree with Lanice. Well, I was officially diagnosed in 2014, but I probably started showing symptoms about 3 years before that, but I didn't have medical insurance. The Affordable Health Care Act gave me medical insurance for the first time in 5 years. I was a college student at the time. I feel like I didn't get a proper diagnosis because they just passed it off as being overweight and didn't do any testing. And instead they were just plying me with different diet pills, different, food programs, and sending me to a nutritionist, getting me tested for my A1C, which was never an issue. So it's, I think, almost just the stigma against obesity played a huge part in not getting a proper diagnosis on time.
All right. And Sophia, what about you?
About me, I was very lucky. In 2013, I started with my symptoms just 1 month before my diagnosis. But my case, my doctors said that my case was the first in Mexico to get the diagnosis so early. I just first went to one doctor who told me a wrong diagnosis. He was going to make a surgery, open heart surgery, but they didn't make the proper tests. After that, I went to another doctor, and since the first beginning, he was suspicious about pulmonary hypertension. But I'm talking here, I'm not just talking about me, Sofia Arevalo. I'm talking about my Latin community, my Mexican community. I've been seeing more than 200 cases, and no one has the same lucky as me. So for them, it took them like more than 5 years, 3 years to get a proper diagnosis. So yes, right now, I'm talking about everyone.
Wow. Interesting. So you were lucky, which were great. That's what we're trying to do, is bring more awareness so that we can identify this sooner.
Yes, because at that point on 2013, I remember the day before of my catheterism, I started looking on Google about what is pulmonary hypertension in Mexico in Spanish. I had the worst information. Everything was, you're going to die in 3 months. You cannot be pregnant. Yes, I was crying like crazy because I was praying, please, I don't want to have this. But well, at the end, that was my diagnosis. But that's why I started the association in Mexico, because I was trying to spread the word, because no one knows about this illness.
Great. We are very grateful for you doing that. Thank you so much.
Thank you.
We need that. Any awareness we can spread is amazing. Do any of you, maybe Lanice, Kira, do you feel like there were any like cultural insensitivities that played a role in your, delay in diagnosis?
In my case, yes. That there were. I have very good insurance, and I went to really what I considered great doctors. But I think that really what they saw was a little short, fat Black woman. And I think that's all they saw, because I noticed that different patients who still went to the doctors that I went to, their care seemed to have been much different. They seemed to have spent more time But then I remember one time, my heart had stopped. I was admitted, my heart had stopped. And after I got out, I went to do my follow-up, and the doctor came. I went to him, and he said, walked in the room, said, okay, well, you know what? Everything seems to be good. So I'll see you in 3 months. I waited right till he got to the door, and I said, so my heart stopped. That means nothing to you. He literally backed up into the room, sit down and talk to me. So I feel that culture-wise, Dr. Harrison Farber had made the statement one time, not only your ethnicity determines your care, but so does your zip code. And I think that because I was in a little town in New Jersey, that it just wasn't paid as much attention to. And you know, in the town I lived in, there's one side is the haves and one side is the have-nots. And I believe that it wasn't until I got to a bigger city hospital, that's when I was diagnosed, not in the little town that I lived in.
Wow.
So yeah, culturally, absolutely, without a doubt.
Yeah. What about you, Kira? Anything?
As a queer woman, no. Especially when you first start getting treated by a doctor, you don't always out yourself because you don't know whether it's a safe space or not. So if I don't always present as a queer woman, or I'm not as obvious as some people are, where if I don't provide that information, sometimes they don't ask. So it's not an issue. So on the surface, they see a cisgendered white woman, and you know, except for, so culturally, I guess, no, I haven't received any barriers. Economically, absolutely. Because I'm on Medicaid, I'm on government funded, and that comes with its own stigma.
Okay. We've got to do better. We've got to do better. So what does your support circle look like? What about you, Sophia? What's your support circle? Do you have like family, friends, people in your community?
Yes. First is my family. My caregiver at first was my sister. Then my other I have two sisters, and my family is very. We are very close. So my family is my first. Also, my PH community in Mexico. We are very close to each other, our Latin community. Yes, that's my support, my friends and everyone. They are always trying to help me. Like, it's always funny. Now it's funny because I go to the weddings with my POC and they are like, do you need help? But I'm dancing with them, with my POC, and everyone is very nice. Like, they don't look at me like a different person.
Good.
Yes.
What about you, Kira? What's your support circle look like?
I'm lucky. I have a pretty big support circle. I have my partner, Andy, our two dogs. My family, her family, I have family back east. My twin brother lives out there. Her twin lives here in Aurora, or here in the Colorado area. So we've, yeah, I have two best friends and their wives that are like family. And so it's, I'm really lucky in that aspect. I have a pretty large support group.
Good. Lanice?
Okay. Family can be funny. A lot of times family loves you so much that they don't want to admit that you have this illness that's not going away. Friends, you know, with PH, you never know how you're going to feel. You might make arrangements to do something, to go on an outing with somebody, then all of a sudden you have to cancel. So I think for me, it was, I have some members of my family are incredibly supportive. Others prefer to act like there's nothing going on, you know, like Do you really need this oxygen? Yeah. Come you walk so slow? You know, and then you have the friends. I had a friend one time tell me, well, I just can't bear to see you like this. And I thought, you can't bear to see me like this. How do you think I feel? But I think that for me, it has been a learning experience. So I have some family support, and the ones who do support me are exceptional. I have some friend support. The ones that do support me are exceptional. I have PH friends and who I consider friends who are exceptionally supportive. My support groups and the groups I go to are exceptionally support. And I have a church family that is exceptionally supportive, but not everybody is supportive now.
Well, for all of you, if nothing else, you also have another family, and that's this big PH family that we have.
Yes.
We are here to support each other always, no matter what. So don't ever forget that.
Thank you.
right.
We know that.
Well, and Team Phenomenal Hope has an amazing support group that have,
Yes.
I mean, that's how I met Lanice, and she's like my other mom. So it's, you know, you meet these amazing, remarkable people in your own community, and a lot of that is thankful to Team Phenomenal Hope for that opportunity.
You know,
Yep.
support groups are the biggest support we have. I remember when I was first diagnosed, I felt so alone because I knew nobody else with PH. I'm like Sophia, I Googled it. I'm like, what the heck is PH? So I went to my first support group. It was at York Presbyterian Methodist. And I walked in and there were all these people with oxygen. I was like, my people, this is lovely. It's not just me, you know. But support groups and I love my support group. And I mean, Kira is my baby girl, but she's one of my baby girls. I got another one here too. But the thing is that support groups you have to find the right one.
Yeah, I hear that a lot. I'm a big advocate for support groups, but I do agree. You do have to find the right one because you do have some
Yes.
long timers that are kind of like, but we want to keep this family thing going, and we want to keep the hope going, keep hope alive.
Yes, for me, to see people who has been diagnosed for so many years was a lot of hope to me because I was feeling like, okay, I can do this. I can handle this. Yes.
Yes.
Absolutely.
I agree. I truly agree. Like people that have had it a long time, it speaks volumes to, newly diagnosed patients.
Yes.
So it's like kind of share your diagnosis and how long it's been. It may have been a journey and may have been a roller coaster, but you made it and you're here and you're still going.
Yes.
At least we know now. I mean, like I think Sophia said it. You know, when I first Googled it, I was told I was going to be dead in 3 years. I was like, oh my God, I planned my funeral and everything.
Yes.
What the heck? I picked out my dress.
Yes, it was crazy.
Yes.
Yes.
Yeah, no, that was the information I got too, is that I was and I spent the next 3 years waiting to die. Like it was bad. And I wish that we had a support group then that would say, hey, we have people living with this for 20 plus years. Like,
yes. When I hear that, like people living with more than 20 years, I will thank God.
Right.
Yes.
Yeah. And you think about it, the people that have been around that long, they didn't even have all the therapies we have now.
Exactly.
So that should give you even more hope. Because they made it this far with what we had then, and look at the vast array of what we have now and what's to come.
Yes, even because we are like 1 year apart, Lenny, Kira, and me, from our diagnosis. At that point, well, in Mexico, we only had 2 treatments, Bosentan and sildenafil. And now we have like, I don't know, 14 treatments. Yes.
Yep. So, Sophia, I want to dig a little deeper and ask you. I know you get your treatment in Mexico or in the US?
In Mexico. Right now, I have a situation because on November last year, I had a very bad crisis. I got very sick because I got this virus on my stomach, and I was in Mexico City, which is very high altitude, and it was the perfect storm for me. So I was about to start the transplant list. So yes, it was crazy. So on February, I started thinking, because I was living in Tijuana. Tijuana is the border city with San Diego, California. So at that point on March, I decided that I need to move to a better place to have a better quality of life. Since 2 years ago, I started looking for the sotatercept, the medicine, and at that year, this year on April, it got approved by the FDA. So I started looking for it, but in Mexico, here we don't have that treatment. So I started looking for some support, and I'm still trying to find it because I don't have. I have my insurance here in Mexico, but it's impossible to get the medicine because here in Mexico it's not for sale or approved. So yes, right now I'm trying to get that medicine. I'm trying to get an American doctor there, but it's kind of complicated. So I'm right now on that complicated journey. Yes.
Okay. Do you have any family or friends in the US here?
I have family. My sister lives in Seattle with her husband and her kid. And friends, yes, I have friends in San Diego, my PH friends. But yes, I have family and friends. I work here in Mexico. I'm an architect, so I have my projects here. But the only thing I'm trying to do right now is to get that amazing medicine.
Well, we're gonna keep praying that something comes through and you can get it.
Yeah.
Absolutely.
Yeah. So I want to ask you all, one at a time, of course. Have you been involved in like your treatment decisions and in your treatment planning? Lanice is thinking about it.
Well, you know what? I have been involved in my treatment plans now. And that's only because I have doctors who support me. When I was first beginning my journey, I had 3 different PH doctors. Well, they weren't PH doctors. That's the thing. They weren't specialists. They weren't PH specialists. They were pulmonary doctors, but they weren't PH specialists. So I had 3 before I got to my pulmonary hypertension specialist. And because I've had a couple of diagnoses. My very first diagnosis was portal pulmonary hypertension because of my liver disease. Then a doctor who was not a PH specialist said, no, it's because of left heart failure. So that kind of stuck for a while, but it looks like we might be going back to the portal pulmonary. It's like a journey. But my thing is that the doctors that I had, I was not involved in my treatment because they did not involve me. They came in, they saw what they wanted to do, they said what they wanted to say, and then they were out the door. So I knew those were not the doctors for me. So the doctors I have now, yes, I am involved in the treatment, and we discuss things, and we are in contact when necessary. But that was not always the way. But I think that as we grow in the journey, we know more of what we're going to do than what we're not going to do. So I think it's a growth thing. So
Yeah.
the long answer is yes now. Not
And I think it's important to also remember to advocate for yourself and don't ever feel like, you know, you don't want to ask a question. If you don't understand something, you ask. That's what we're here for, is to explain it to you. Whether it's the doctor has to go and the nurse has to come and explain it to you, that's what we're here for, because we want you to understand, you know, the medications and why you're taking them or why we're changing them or what they're doing. It's important that you understand that since you're taking it. What about you, Kira?
Pre-diagnosis? No, absolutely not. But I was not very good or experienced enough to advocate for myself. So, I mean, most of the primary care doctors that I was working with came in, took one look at me, and they decided, just looking at me, what was wrong, and didn't do any testing. It wasn't until I got a referral to National Jewish Health in Denver that I finally found doctors that not only were willing to listen to me, but involved me in my own care. They explained things to me. They tested. They were respectful and understanding. And I'm really lucky because now I'm absolutely included. And the Pulmonary Hypertension Clinic at National Jewish Health is probably one of the best that you will ever find, in my opinion. I'm biased, but they're amazing. They really keep you informed. They let you know what upcoming treatments are coming, whether you will qualify for them, as soon as they have this information, and they're just amazing. I mean, between Dr. George and all of my my PH nurses, I call them my three musketeers. They're just amazing. They're just great people. So I'm really lucky that now I have found a PH clinic that does include me and in my treatment plan.
That's good, because you are part of your medical team. And don't ever forget that. And what about you, Sophia?
For me, in Mexico, we don't have a lot of PH clinic. Well, we only have 2 PH clinics in Mexico. So my doctor, he's the best doctor in Mexico. But the only thing, I'm always pushing for the best treatment. I always come to the appointments with a huge list of information about the new treatments, about everything. Like, I'm always looking for research and trying to learn. Sometimes it's complicated because they don't listen to me, because I'm always pushing. I'm a very complicated patient because I have a lot of energy. So I used to do a lot of things. I'm still trying to do a lot of things, but they don't always listen to me. Like, I'm always pushing for the best treatment, but they are always like, no, we have to wait. Let's wait for this medicine that you are into. But I know that there is something better, but they don't listen to me. So yeah, sometimes it's complicated.
That actually brings me to a question. My next question was going to be, do you feel like your treatment team listens to you, validates your viewpoints, any concerns you have? Do you feel like when you bring that up, that it's addressed, which you've kind of led us into that already. So I'll pass that on to Lanice, because Kira, we know Patty George is your angel. So
It's amazing.
So we know what happens there. It gets done.
That's right.
You know what? I tell you, I am involved in my treatments because, like I said, the doctors I have now. I go to Mount Sinai in New York City, and Dr. Pulmonary is my doctor, and he listens to me. And more
Good.
importantly, not only does he listen to me, but Simone, his PN, listens to me. You know, it doesn't do you any good if the doctor listens, but the nurse doesn't, or the nurse doesn't, the doctor doesn't. They're supposed to be a team. So now they both listen to me only because I've got some mouth on me. I'll tell you why. But I wasn't always like that. But if they did not listen to me, they would not be my doctors. Because, I mean, let's think about this. If you take your car someplace, I mean, I'm just comparing the situation, not the people. If you
Yes.
take your car to a mechanic and they mess up your car, you're not going back. So what the heck are you going back to a doctor for that doesn't listen to you? What is
Right.
going on in the land of Goshen? You're paying for this. But yeah, now they do listen to, well, I have doctors who have respect for me. And I think that's what it comes down to. Respect. Do you
Yep.
respect your patient? Do you respect their stances? Do you care enough to listen, or are you watching your watch?
Yeah. Building that relationship and that rapport with each other, because we're in it together for the long run. So
Exactly.
we got to get comfortable with each other because we're going to be bosom buddies. So what changed that made you mentioned that, you know, you weren't always the type to kind of speak up. So what changed? What changed and made you start to speak up for yourself? And
It was at that instant where my heart had stopped, and the doctor wasn't even aware, and this is supposed to be my doctor. And also, too, my husband had died, and he would have been my advocate. And my children have their own children and husbands and wives. So, you know, they have their own lives. So I figured it out that it had to be me. And when I really figured it out that I wasn't being listened to, that people weren't taking and I was sitting back saying, okay. I think with the pH thing, it was more along the line of, I just didn't know what pH was. I honestly didn't know how bad it could get. So when I had my first heart cath, the doctor that did the heart cath was not my doctor, said, oh, your heart looks good. Then I got another one 5 minutes later, my cardiologist saying, okay, we know what's wrong, you have pH. Well, how is my heart looking good and I have pH? So I think that those types of things where first off, I got cross information, and second, that I was not being listened to, made me just say, okay, if you don't advocate for yourself, you can't expect anybody else to. And 2 nurses taught me that. Mary Ann Fedora at Methodist and Kimberly Hageman at my insurance company. You've got to advocate for yourself.
that is
Yes.
correct. What about research, clinical research trials? Have you all ever done any research on it and kind of, well, I know Sophia does lots of research and she comes ready with her list. But have you done any research or keep up with the latest trials and things that's going on, and maybe talk about that when you come? Or do you just wait when you go to your appointment and they discuss the clinical trials that are ongoing or coming up with you?
For me, I don't like to wait. So I always I see this new trial, so I email my doctor. The thing is that they don't always listen to me. Once not once, a lot of times he was like, okay, next time I'm not going to be here. You can do the diagnosis, you can get your treatment. Yes, like he was trying to say to me, like, he's the doctor and he is going to make all the decisions. So,
Well,
but the problem in Mexico is that we don't have a lot of options, you know,
right.
and he is a very good doctor. So most of the times, at the end, I am like, okay, he's a really good doctor, but I don't have other options neither, you know. That's why I also I want another option.
Yeah, I could understand that. I mean,
Yeah.
you're kind of roll up the sleeves, get it done. I know what I want. I know what I need. Let's do this. So yeah, I agree. You want to be heard,
Mm-hmm. Yes.
and you want to be part of your healthcare team, as you should.
Yes.
What about you, Kira?
I don't mind being a guinea pig. I've been a guinea pig a couple of different times. Sometimes it's great, other times not so great. But you know what? We find out what works and what doesn't work. And
Yes.
I figure if the clinical trials are going to help other people in my PH community, somebody's got to do it. So, might as well. I mean, I look cute eating hay. I can do it.
Well, we thank you for that, and
Yes, thank you.
I'll just piggyback on that myself, just to put a little plug in. I am a big advocate for clinical trials, and I'm sure Lanice understands, as being a Black woman, that we do have a lot of Black people that are not in clinical trials, and that has to change. And part of it is, and this is my personal opinion of what I think it is. Part of it is a lot of African American Black people don't trust the medical system because of what happened so long ago. So it's important for Black people like me that are in healthcare to explain to them that that is no longer. There have been things that have been put in place. There's regulations and rules that are put in place so that does not happen. And I just, I can't stress enough how I'm trying to push to get more Black people involved in clinical trials, because it's interesting when you sit around and you hear people say, well, they give me this medicine and it doesn't work for me. It doesn't work in Black people. And my response is always, well, when Black people don't participate in clinical trials, you can't see what happens and how the drug works for us. So it's important that we kind of spread that word to get them in the clinical trials. And I mean, I see it all the time with our trials now. We need to get more, these trials need to get more diverse. And it's not on them, it's on us to do the legwork. So
true. I mean, I'm a big fan of clinical trials because I believe that is the only way that we're going to find cures. I think within our Black community, as you mentioned, there is a huge distrust of doctors. Part of it goes back to Tuskegee. We were experimented on, and we knew there was no cure. Henrietta Lacks, when she was 1951, at the age of 31, she died of cervical cancer, but they harvested her cells, never asked the family, never got her consent. And they're still using the cells today. They're called the HeLa cells. And also, too, because going back centuries, when we weren't allowed to go to doctors, a lot of Black people, especially older Black people, Black Americans, will say, I'm just waiting on the Lord. God is going to take care of me. Have you been to the doctor? No, God will take me when he's ready to take me. And it's not as prevalent among younger African Americans as it was like with my mother's generation, or even some people in my generation, that, they feel like and it's sad because they feel like nobody's going to listen. Nobody's going to take the time.
Right.
You're not going to get treated. And I'm saying this sincerely from my heart, the medicine is so expensive, they know they can't afford it anyway. So they just tend to sit back and say, God will take care of me. But we need to get past these things. People love me in a study because I'm Black. I get asked for studies all the time, and I participate because there's not enough information about us.
It's not, and I every day I try, and I'm not going to stop. because it has to change and we have to change. So let's talk about, work, school, the things that you do every day, things that you did early on in your diagnosis. Did you have any barriers that you faced, early on in your diagnosis, or even now, like Sophia's still working, any barriers you face now or challenges that you have?
Well, for me, yes, it has been a roller coaster. I'm an architect, but I used to work first. Right now, I have my own architecture and interior design studio. So right now, I'm just designing. But I used to have, well, my family has a construction company. So for me, it's so complicated to go to the appointments with the clients because it was always on buildings. So for me, it was always like the appointment is at 11. Okay, I need to be there 2 hours before to start climbing the stairs, and to take a breath. Yeah, and everything. But yes, it was very complicated for me for a lot of years, and still is also because I never stopped working because I love my job. But it's complicated for me to just stay 8 hours in the computer, Yes, I think it's a barrier. I never stop working, but sometimes it's complicated. Like yesterday, I wasn't feeling really well, so I needed to cancel a big meeting, and you have to tell the clients about what's going on. So yes, and sometimes it's not professional to cancel meetings because your illness, but that's what it is.
Sounds like you had to make lots of adjustments, but I'm glad you found a way to keep working, especially when you're passionate and love what you do.
Yes.
Yeah, keep at it, girlfriend.
Absolutely, go girl, go.
Yes.
I'm a retired federal employee. I worked for the Department of the Army for 25 years. And I worked out in New Jersey. I managed 3 offices, one in Camp Point in Korea, one in Fort Monmouth, New Jersey, and one in Portchester, Hawaii. And that was in New Jersey. When I transferred my job when Fort Monmouth closed, I came to the Army Engineers, and I loved my job. I loved my job. But once it got to the point where I was always in and out of the hospital. And then because I use tanks, and if you ever, they don't want you to go into, I worked at 26 Federal Plaza. They don't want you to go into a federal building with a hairpin that's metal, much less lug 2 tanks through the door. So it became, and then on top of that, I could carry 2 tanks. So my work day lasted only as long as the oxygen I had, and that had to include me getting to work and getting home from work. And after about a year away from retirement, my boss let me work from home, which was fabulous. But then you have that extra pressure of, okay, I have to be near the phone all the time because I don't want them to think I'm taking advantage of working from home. And then I was still getting sick, and it just became so much. So the job that I went to school for and loved, I had to retire. And I retired at 61, and I just was not ready to. I did not want to retire, but I was just getting too sick.
Yeah. What about you, Kira?
Well, I was a college student when I first started experiencing symptoms. I was 30 years old. I was working on my bachelor's degree, and just before, like 2-3 years before diagnosis, it started getting harder to breathe, harder to walk around campus. So I ended up taking online classes. And even then, I just ended up being tired all the time, and it just was hard to even maintain any kind of attendance with some of the online classes. And then just after I turned 30, I started going into the hospital. That was my dog. I was going into the hospital like every 3 to 6 months, probably every 3 months at that point, just for fluid overload, heart issues, just getting diuresed. It was just, it was terrible. It was just in and out. And so I ended up having to drop out of college. I think I was one semester away from completing my bachelor's. And then the next 6 years or so ended up just being in and out of hospitals, working on my own treatment. Like, your healthcare ends up becoming a full-time job. It was hard to even go to the movies, let alone work. So, I mean, just the idea of carrying oxygen clear across campus, like to finish up schooling, was just insane. And I've been told I should go back and finish, but at this point I'm permanently disabled. If I were to go back, I would have all of these student loans, and I wouldn't be able to maintain a job to pay them off. So it was frustrating, because it totally, it revamps your life. You have to, what you thought your life was going to look like isn't anything like what you thought it was going to look like. And so a lot of people like saying that you have to accept your new normal. And it's true. And it's also as frustrating as hell, because you don't want that new normal. You wanted your normal.
Right.
And my normal looked pretty good in my head, But I mean, sitting where I am now, looking back, like, I'm glad that my life looks the way that it looks. I'm pretty happy with my life and the people that are in it that I would have never have met otherwise. So it's, it definitely, like, you definitely face all of those barriers with work, school, even just getting out and socializing with your community. And it's incredibly frustrating. But it doesn't have to be, not all the time anyways.
Yeah. That was great. We got a little bit of everything. We got the student, we got the retired, we got the still getting at it girl. But yeah, I mean, God bless you, Kira, because that was a total change. I mean, everybody made some adjustments, but you had to like really totally change your track completely. So,
well, and my daughter was 7, I think, when I first got diagnosed. So trying to parent, a single parent, while going to college, while dealing with a chronic illness, was incredibly difficult. And if I didn't have the family that I have, it would have been impossible. But I was really lucky, because my mother and my stepdad really stepped up and helped me with that, and helped me with her, and made sure that even when I was at the hospital, I still got visits from my girl. And, we would do forts, little forts and movie nights in the hospital, and, do that kind of stuff. But there are plenty of other PH patients, especially that are single parents, that don't have that kind of support system. And then it's like, what do you do with your kid? Like, who's taking care of them? And then you have to deal with all of that guilt that's associated with that. And it's really difficult. But you find a way.
Wow. So, given the opportunity, are there any perspectives you would change about your healthcare providers that could benefit you and other patients at all, for anyone? Not putting anybody on the spot to say anything's wrong or bad. Just, there may be something that you can offer that someone out there hears and takes away? Like, you heard something from me, Lanice, that you took away before.
You know what? I think that I would not change. I think that lots of times for the doctors, it's not the doctors, it's the system they work under. If you have patients, like I know when I go to my PH doctor on East what is that? East 102nd Street. For me, that's a 2-hour ride. So when I get there, and if you're only supposed to have 10, 15, what is it, 15 minutes, 20 minutes, something like that, it's a 2-hour ride up there for 15, 20 minutes, and then a 2-hour ride back. That's not my doctor's fault. That is the system that they work under that says, okay, you doctors can only spend this much amount of time with doctors. And I think that their system needs to be changed because I don't think that that's fair to them. Another thing that I would say is the cost of medicine for middle class America is ridiculous. There are no programs available. A lot of pharmaceutical companies have programs available if you have a lower income. But when you are middle class, I've met people who are struggling each and every month because they couldn't get foundational funding to pay $3,000 for a medicine. That's absolutely ridiculous in this country, and there's no program to help them. That's crazy. When I first got my medicine for my pancreas, it was $700 and something a month. What the heck? I mean, wow. And that, of course, that's not near to $3,000. Come on, and you don't even have some kind of program where you could cut it in half. Are pharmaceutical companies that poor that they can't do that? So that's another thing. Also, the one thing I will say about doctors is, before you prescribe something, know how much it costs. Know how much that medicine costs, because a lot of people, especially if you're in that quote unquote middle class area, okay, you have already spent so much money that you've already dug into your savings. I've known people who have sold their houses from one state to another to move to a cheaper area so that they can afford to buy their medicine. That's crazy. But then we have doctors sometimes, and God bless them, they want the best for you. But check and see how much that medicine is. One doctor gave me a prescription. I said, how much is this expensive? No, it's not expensive. The pharmacy calls me, Mrs. Whitley, this is over $300 a month. Cancel it. So I called him. I'm like, what is not expensive to you? What is going? This is a month's worth of food. What are you doing? So if I had anything that would change, I would like to see the system change where the doctors aren't worked to death like workhorses. I would like to see pharmaceutical companies lower some of that medicine, or at least have a program for middle class people so that they don't have to sell their house, sell their car, lose the states they never wanted to live in the first place, just to buy their medicine. And I think that doctors need to know how much their medicine. Okay, I'm done.
I agree with you on a lot of that, because I have been in situations where, there may be something that we want to give someone, and because we know the patients very well, it's a situation where I'm going, I know they can't afford this. So now we've got to come up with a plan. And I might even express that to them. I think this is great, but, I know that you can't afford it and there's no help right now, especially if it's someone on Medicare, because you really can't have any help. Even if there was copay cards, things like that, you can't have it. So it comes to a point where we have to go back to the drawing board and find something else. But I do know, like you said, there are doctors that are like, well, this is what they need to have, and this is what we're going to prescribe. But my comeback with that is, you can prescribe it all day long, but if they can't get it, they can't take it. So we have to make sure that we do our due diligence to make sure we give you something that is affordable to you, that you can take. Yeah. So I agree. We need to change this healthcare system we got going on here.
And stop working our doctors to death. Do they have to see 20 patients in a day? Come on.
Yeah. And you're right. It's the system.
Yeah.
It's the system that, for them, it's a business. They don't really get it. What about you, Kira?
I think we need to work on the perspectives concerning gender, especially for us in the queer community. Asking someone what their pronouns are may not seem like a big deal to most people, but being asked what my pronouns are, which are she and her, lets me know that where I am is a safe, inclusive space where I can express myself freely and not have to worry about judgment or any kind of backlash. And that's a space that not a lot of people have, which is unfortunate. And it's something, I mean, super easy. Just asking somebody what their pronouns are is just a super easy way of saying, we're an ally, you know, you're safe here. And you'll find that those people will open up a whole heck of a lot more than they would have if they thought that you weren't. I think views on obesity should be changed as well. Like, we know it's a health concern. We live with it. You know, I know what it's like every single day. Don't think that I don't, or don't think that you have to teach me about it, because I know. And don't be blinded by it. Don't dismiss my symptoms because that's all you see. And that is so unfortunately common. Like, all my life, I have been a heavy set person, all my life. And all my life, I have multiple stories of doctors shutting me down because all they saw was weight, and they didn't want to see what the actual issue was. And it's incredibly frustrating and dehumanizing, because then you feel like you have absolutely no self-worth because now it's attached to a number. And that's not the case. It took me years in therapy to be like, you know what? Screw you. Like, this is me. This is my body. You know, it's not ideal, but I am doing the best that I can with what I have. And my self-worth is not tied into a number on a scale.
I love it.
Here we go.
What about you, Sophia?
Well, in Mexico, we have a really big problem in the health system. No one is allowed to the pH treatment, or if you are allowed, or they give it to you with the government programs. Every month you have to deal with them. All of the patients need to go to the hospitals, beg for their treatments, and they don't have it. Sometimes 1 month they have it, the next 3 months they don't have it. So yes, it's a very problematic in Mexico. Our patients from the associations are always asking us or to the doctors for medicines. But yes, it's a really big issue. Now, I'm going to talk about, from my perspective right now, my personal perspective. I'm trying to get medical support in the US. But since the moment that your name is Sofia Arevalo, Sofia with F, not with PH, or Arevalo, which is a Spanish surname, they are like, no, you are trying to work here. They don't see you as other thing. You try to explain to them that you, okay, I'm an architect. I work every day with my projects, with my clients and everything. I never stop working, but the only thing that the government see in me, it's like, I am Mexican, I want to work in the US, I want your money. That's a big problem for us, for our Latin community. Yes.
So unfair.
I'm so sorry.
So unfair.
Yeah. So unfair. Yeah.
Uh-huh.
Yes.
So I think I saw a few things in the chat that I wanted to share with you guys. Lots of good stuff here.
There we go.
So someone did, and I do agree. There's someone in the chat that said, I hope that someday soon the idea that moving a meeting due to health reasons is unprofessional changes. And I couldn't agree with you more, because that is so true. I mean, it shouldn't be like that. You shouldn't have to feel like that's unprofessional, because that's your health. And that's more important. We can move a meeting. And then, oh, this is interesting. 35 years of IT expertise stopped on a dime. Wow. So what a change. What a change to have to adjust to, like, just no more work. I'm sick now and I can't do it anymore after 35 years. Yeah. Yes, my specialist categorizes my pH as category 5 from polycythemia vera and clotting. I've lost half my lung capacity and part of my heart. It is associated with thrombosis complications. Fatigue is the new norm. Oh, well, keep trying and keep going. Don't ever give up. Fatigue is your new norm, and it seems like you've accepted that, but we got to get you where your fatigue is your sometimes norm. This whole healthcare system based on capitalism is antithetical to health. Yeah, our healthcare system is bad. It's got to change. And, you know, even hearing from you, Sophia, how, you know, it's no better.
Yes.
Like, somebody's got to do something. We've got to change some things.
You shouldn't be able to put a price on someone's life.
Exactly.
Exactly.
And medicine that is needed should not be so far out of reach that people who need it to live cannot get it.
Mm-hmm.
I read a book, it was called How to Be Sick. And one of the quotes was that I'm not giving up on life. I'm just adjusting to my new life. And I think that's what most of us do as PH patients. It's not that we're giving up. We're making the adjustments that we can make to continue to have a good quality of life.
Exactly.
Yep. Yeah. So I have one takeaway question for everyone. What advice do you have for fellow patients who have had or, you know, are new to experiencing like barriers to their care? Because you guys are you're some long timers. So what advice would you have for them? Because, you know, there's lots of people out here listening, and even some that aren't listening, they will get this information from someone. And for me, all I say all the time is advocate for yourself. You are your best advocate. We as healthcare professionals advocate for you, but you have to advocate. You're your best advocate.
And that's pretty much the same thing that I would say, is that don't be afraid to advocate for yourself. It's important for you to find doctors that will not only listen, but also provide a safe space for you to be able to communicate your needs and your concerns.
And I think too that something that we can all do to help each other or help ourselves is attend a good support group, because support groups will have people who are already dealing with what you're dealing with. Team Phenomenal Hope has one. I run the support group. You run my support group. We now have a Spanish support group that Sophia runs. Join that support group. Join support groups where you can get support. And that way, because we do talk about the newest medications, we do have people that are on that are either medical experts or dietary experts or exercise experts, whoever. We, join a good support group and get that support, because if you're trying to fight this battle by yourself, you're going to get awful tired. So join a good support and make friends and see what's going on in the community. And it should be a community. It should be a community of patients, whether no matter what support group you join, it should be a community of patients. So join a good support group. And don't, I heard Sophia say her doctors don't, basically what I heard her say was that, her doctors don't really listen to her. If you have a doctor that doesn't listen to her, then you need a new doctor. If they're not listening to you, you need a new one. I hear people say, I'm going to keep my doctor because they're on the board. They're all on the board. It's called the board of medicine. Get you a new doctor. Just because you've been your doctor for 20 years doesn't mean you have to keep that sucker. I mean, what is that? That doctor? I'm trying. Get a new doctor. Get one that will listen to you and help.
Yes.
My advice, I started like 6 years ago, trying to see the whole picture of my illness. So what it really helped me was that I not only have to look for only the medical treatment. I need to look for my emotional health. I needed to look for my with a psychologist, with emotional care, with the food I was eating, the breathing exercises, not just focus on the medicines. You have plenty of other options that it's an integral treatment. So that worked for me a lot. Just just don't go only for the medicines. You have to go all over everything, support groups, psychologist, nutritionist, yes, everything.
And you're right, Sophia, because as we're talking about cultural perspectives, when you talk about nutritionists and diet, that's a big factor, because culturally there are different foods and things that we have.
Yes.
And different traditions where you have certain foods and things that maybe you no longer can have. Exactly. And so, yeah, you're right. You have to find a way to adjust.
Yes, you have to find a way to adjust everything, and you will find the best treatment for you. Now we have a lot of information everywhere. Like social media is not just about the fun or everything. I find a lot of information out there in social media, also in books. I always try to read books for my mental care. So yes, try to focus on the whole picture.
I really appreciate what you said about mental health, though. It is so crucial, because you're right. If you're struggling with depression and anxiety after your diagnosis, you are not going to take care of yourself fully as you would as if you were taking care of your mental health too.
Yes.
So, going based off of what you said, Sophia, I would totally recommend people get a therapist. Not just a support group, but a therapist that can help you process it, because you're going to be grieving and you need to process that grief in a healthy way. And you're going to need a mental health support system to help you manage that.
Yes.
And, I think it is important too to don't beat yourself up. There's going to be days when you can't there's going to be days when it's just not going to work for you. There's going to be days when you're in your bed. Don't beat yourself up. Turn on the TV, binge. Let me tell you, I binge watch Scooby-Doo because it just takes my mind off of everything. And I joined this a PH book club, which is phenomenal. And what you were saying about exercise and things, yes, absolutely. I went to Pulmonary Wellness Foundation in New York City, and I tell you what, it really did change my life. But also too, find the thing that makes you feel, that gives you comfort. For me, it's my faith, it's my church, but it's also my friends, my PH friends, and You have to find what makes you okay with this because it's not going away.
Exactly.
So get the help that you need.
Yeah. Agree. Let's see. We got another comment in our chat. I just started with Pulmonary Wellness Foundation.
Oh, excellent. I went for 5 years. It was the best thing ever. Noah is Noah.
He's phenomenal.
But he is the best ever. Good luck. I went from walking half a block to 2 miles by the time I was done. So
Wow.
Noah is, and he's going to be on our November support group, by the way. But yeah, but don't beat yourself up. It's nothing. I mean, do what you can do.
Yes.
So the rest of it.
And don't focus on what you cannot do.
Can't do. That's right.
Yes.
Focus on what you can, not what you
Yes.
can't.
Absolutely.
Yes. And if one good thing came out of COVID, it was to allow us to do this and now have support groups online and these kind of meetings online. So if one thing we got out of that awful time was this, to meet each other, because I think this has helped a lot. It's helped people meet more people, folks that don't get out much, and then some folks that just aren't, don't like to get out. There are people that kind of like to be home. So hop online, get in one of those support groups. It doesn't matter where you live.
It really does. And I mean, we're on Zoom and, teamphenomenalhope.org and look on the support group. But I do want to say thank you to all the doctors, the nurses, the medical staff. And let me tell you, pharmaceutical companies, as much as I talked about the money they charge, are doing phenomenal things. So, thank you for that.
We're finding that balance. Yeah. Oh, so she said she's doing pulmonary wellness online. She said, but he is crazy. Noah.
Noah is
great.
you have to experience Noah for yourself. But you know what? I never met a more intelligent man when it comes to it. So he is absolutely the best.
Yes. Anyone want to share anything before we come to a close? No. Well, I want to say thank you to you all. I think we had a wonderful panel here. We had everything right here. Anything you wanted to hear, any adjustments, it was right here. So I think this was great to have you all. I'm sure we'll do this again. And thank you so much.
Thank you. Thank you, Denise. You haven't now go home. You've been at work all day. Oh, thank you all.
Thank you very much.
Thank you. Bye-bye.